Good afternoon, everyone. This is Dr. Micah Allen. I am so excited to be here with you guys today. Again, we're going to be chatting just for a few moments today about high blood pressure and how you can manage your high blood pressure and whether or not your blood pressure is managing you. So, this is all about, advocating for yourself. Um, just wrapped up a few clarity calls that went amazingly well. So I'm really excited about that. Had an opportunity to see some patients this morning in the brick and mortar. So today is going absolutely well. So I hope you guys are having a wonderful day so far. Hopefully you've had a chance to get outside because spring has definitely sprung here in the Richmond, Virginia area. And so if you can, just drop some comments in the comment section. Let me know where you're chiming in from. Rep your city. Let me know where you're from. And yeah, if you have any questions during this time, please don't hesitate to drop them in the comments, okay? And then also share this broadcast with your friends, with your family, those who you think would benefit from this information. And I'm just going to go ahead and hop right in. So awesome. So managing your blood pressure versus your blood pressure managing you. And so in my clinical practice, as well as in my personal history as well, having navigated through high blood pressure, the polypharmacy or management of several medications can be overwhelming, to say the least. I have some clients that I get the joy of helping to support who, maybe on 4 or 5 medications at once, right? And so we're going to need to and be very aware of any interactions that might be occurring either between the medications, between medications and supplements. All of those things are going to be very, very important to know. So if you are taking meds for your blood pressure, whether it be a diuretic or a beta blocker or calcium channel blocker, all of those are some of the commonly used meds. Again, making sure that you have open communication with your primary care physician, your pharmacist. And so a lot of times in pharmacy, in the past, we've had tons of conversation with pharmacists just to make sure that those things are in place and that we have a clear understanding. So keep those modes of communication open for sure. So awesome. So we have some folks in from Greensboro, North Carolina. Ms. Janae, thanks for joining. And Richmond, Virginia is in the house. So yes, it's great to have you guys. Great to have you guys on. And so that would be like the first step that I'd say as far as you managing your life and your blood pressure versus, the blood pressure taking control of your life is just knowing your status, knowing what meds you're taking, knowing if there's any interactions, reducing those if possible, okay? And then I would say the next step, just thinking about the news just this week, right? Pfizer released information stating that one of their, well, actually 2 lots of their medications were contaminated with a carcinogen, nitrosamine, which we see nitrosamine in cured meats, preserved meats. We see it in, within our food system, within the environment. But Pfizer stated that some of their medications that are currently in circulation have higher than normal doses of nitrosamine, which could cause cancer down the line, right? And so again, being aware of alerts like that, and then getting to a place to where you're working towards reducing the number of medications, if you can, with very vital recommendations around diet, exercise, stress management. Those things are going to be very helpful. But again, keeping your eyes and ears open for any new information that might come, so that you can make adjustments. Those are going to be really, 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 really important tips to be sure to make. Okay. So yeah, I would love to have you guys to continue to join me here on Fridays, so that way we can impart that information. If you have any questions, you can always drop those in the comments, whether it's during the live event or during the replay. And so we'll do our best to be able to answer those questions. I'm going to go ahead and drop a link in the chat for an application for the Legacy Program. And so the Legacy Program is an all-inclusive program that's going to look at and find that underlying cause of why you might be presenting with high blood pressure. And so this is a program that I've curated specifically for clients who are motivated and excited about finding the cause of their high blood pressure and working towards reducing their reliance on pharmaceutical medications, also increasing their quality of life, right? So again, Clarity Calls this week, a common thread is fatigue. Okay, I take my meds that I'm prescribed, but at the end of the day, I don't have any energy to do anything. Or signs and symptoms that are correlated with high blood pressure, like headaches, fatigue, frequency of urination, cognitive decline, or not being able to concentrate and focus as much as they'd like. So all of those things, when we look at the Legacy Program, we're doing our best to be able to unravel, get to the bottom of it, so that way you can live a life that's full. You can go out and enjoy this beautiful spring weather, ride bikes, interact with your family, have more energy, to just enjoy life, right? So the link to apply to the Legacy Program is in the chat. So if you just click on that link, start the application, and myself and my team will review all the applications. And if you're a great fit, we'll reach out and get you set up for a Clarity Call. And so again, it's always a pleasure. It's great to be here, to be able to exchange energy. And I look forward to seeing you back, not next Friday, but the Friday after. And we'll have an even more exciting topic to review. But again, it's always a blast, and I look forward to seeing you next time. All right, take care.